Let's now go over the emergencies in first aid. The first emergency we'll talk about is asphyxia. Asphyxia is where you don't have enough oxygen, where you have got a deficiency of oxygen in blood, and then there is more carbon dioxide in the body tissues. Normally, body tissues are supposed to have oxygen so that they might be able to carry out the body processes. And carbon dioxide is supposed to be less in the arterial blood. It should be more in venous blood because the veins collect carbon dioxide so that it can be taken to the lungs. And oxygen is supposed to be normally high in arterial blood so that it goes to the tissue, but you don't have enough oxygen. And this can be caused because of the lungs not being sufficient enough to get air from breathing. So even when you breathe, the lungs cannot get enough air. Okay. So breathing is necessary to transfer oxygen from the lungs to the blood on and also onto the tissue and to keep living organisms alive and the tissue alive and functioning. So meaning if breathing stops, the brain, which is the control center of the body, will not receive enough oxygen. Look at how this is affecting each other. So you were not breathing well, so breathing stopped and you didn't have enough oxygen transported to the body. And because of that, there was not enough oxygen which went to the brain. And the brain is what controls the entire body. So the brain cells have been starved of oxygen and so they end up dying. So when the brain cells die and they are the ones which control breathing and they are the ones which control respiration, meaning that respiration will also stop working and breathing also will stop and the heart will also stop beating. So those centers that control respiration will cause breathing to stop first, followed by failure of the heart, and then the person will be able to die. When blood is not being supplied to when oxygen is not supplied to the brain cells die. When the brain cells die, there's not going to be any control on respiration or breathing. So when there's no control on respiration, you're not receiving enough oxygen more and more, and that will cause failure of the heart. Okay. What are the causes of asphyxia? This deficiency of oxygen in the blood and increase in carbon dioxide in the tissue. Anything that will cause disruption to the normal exchange of oxygen and carbon dioxide between the lungs and the outside air is going to cause asphyxia. Let's say your nostrils are blocked. And also airway obstruction. That can be partial or complete blocking of the airway by blood, vomit, or other foreign bodies or plastic papers covering the nostrils. All this can obstruct air from going into the body. Also, gross chest or lung damage, and this can be caused by trauma. For example, when the ribs have been fractured, and this can be caused by crushing the chest. Okay, so this is going to lead to some growth chest or lung damage, and when the lungs are damaged, they will not be able to get oxygen even if you breathe in. You can also have some diseases of lung tissue like asthma. These diseases will make no enough air from going into the lungs, and so that prevents, because air is not going into the lungs, enough of it, which means that little air will also be absorbed from the lungs or taken from the lungs to the blood. Also damage to the respiratory center of the brain. For example, if there is a head injury or there is a stroke, that will cause also this asphyxia, because remember what we said, when the brain is not working, the brain is what controls respiration, so respiration will stop. And when respiration stops, it means you cannot take in air. Inspiration, you cannot inspire, because you have got different respiratory centers in the brain, those centers which control inspiration. So if you cannot inspire, that means that You can't take in oxygen, and that can cause asphyxia. Also, paralysis of the respiratory muscles. Maybe when someone has got polio, muscles that control your breathing in and breathing out cannot no longer contract. So that will also cause asphyxia. Also, drowning. Someone is drowning, you might not be able to take in air. You can't breathe in because when you breathe in, it's water that is going in. Also, when you've experienced an electric shock, also when you inhale smoke and other poisonous gases, as well as cistern sewers in mines, explosion hazards, all these things can actually cause asphyxia. What are the signs and symptoms of asphyxia? You are going to see irregular labored respirations or gasping. So you can't breathe well. Irregular labor, there's a difficulty in respiration, or you are gasping for air. Okay, in that way. There's also complete or absence of breathing. You can no longer breathe. You can also have pallor and cyanosis. This is basically blue discoloration of the face, the tongue, the lips. The color of the person just begins to turn blue. And this is because there is an increase in carbon dioxide. When there is an increase in carbon dioxide, the entire body is just having carbon dioxide. That is what leads to the blue color. Also, inability to speak well or unconsciousness. Someone becomes unconscious because they do not have enough oxygen in the body. How can you manage now this condition? So you should be able to remove the casualty from the affected situation. Let's say, for example, they have asphyxia because of a, let's say there's a they are in a closed room, or they are in a place where there's a lot of smoke, so be able to remove them. And also first try the Heimlich maneuver, grasping the victim from behind with hands linked in front and compressing the abdomen just below the ribs. So this is what we can see here. That's the maneuver. Encourage the victim to cough up foreign objects in the throat as a last resort. Wrap victim between shoulder blades to dislodge the object. So what you want to do is encourage the victim in case maybe they had to take in something. They had to eat something and then it stuck on the throat. You want to tell them to cough so that anything that is on the throat can move out. But in case they can't do that, you hold their shoulder so that you can push away anything that is there. And then for asphyxia caused by gas or fumes, you can remove the victim to a clear atmosphere and then use artificial respiration. That can include mouth to mouth or mouth to nose, as you can see here. Another thing that you can do is open the airway and begin to give mouth to mouth. That is what we are calling as artificial respiration. You also place the patient in a recovery position. Okay. Apply water over the face. Make the patient to drink a sip of water. So someone has asphyxia, apply the water on his face, make them to drink a sip of water, not a lot, and also make sure that you send the casualty to the hospital. Now, what we are calling as the recovery position, we are going to talk about it, and in the next class, in the next tutorial, we'll also show how it looks. Okay. So here is just of what we've been talking about, the Heimlich maneuver there. If it is a baby, let's say something had stuck on the throat, you can hold the baby like this and then just get to place the infant's stomach down across your forearm and give 5 thumbs on the infant's back with the heel of your hand. So you use your heel on the back of the infant like that. You can even do it on yourself in case there's something that had stuck, where you place fist above the navel while grasping fist with other hand. So you are using your fist, you can see where the fist is there. You are also leaning against a chair or countertop. Drive your fist towards yourself with an upward thrust. You are trying to push things away like that. Okay, this is another thing that you're able to do just to make sure that you remove anything. So we said one of the things that we can perform is a mouth to mouth. That is known as a respiratory resuscitation or mouth to mouth resuscitation. So check to see first, how do you do this? You check first to see that the patient is breathing. If he or she is not breathing, you can now start a mouth to mouth resuscitation. Okay, what you do is you place the victim in a supine position, which is also known as a recumbent position, on a firm surface, or a surface that is strong enough so that they will not sink or something like that. A supine position is where someone is facing up, they are lying on their back. That is what is referred, what we talk about as a recovery, something that like a recovery position. What you also want to do is now you loosen tight clothing from around the neck and chest and waist. Anything that is tight, remove it. Now you lift the jaw of the victim, and the reason as to why you are lifting the jaw of the victim is you want to make sure that you extend his neck to allow the tongue to fall forward. And the reason as to why you are doing this is you want to make sure that the person can be able to have air to go in. So what you want to do is you extend the neck. Extending the neck means more like pushing the head behind. Remember, the person is lying down, but then you more like push the head behind like that, so that they can be able to allow air to go in. You are going to hold the head in position by the jaw with one hand. You want to close the nostrils. You shut the nostrils with the other hand. You take in a deep breath. You place your mouth over the mouth of the victim, and then you ensure you make a good seal with your lips. You want to make sure that your lips and the lips of the same victim, they have what? They have sealed so that air will not be able to escape around the edges. And then you blow into the victim's mouth. Turn your head to watch the chest rise. So you need to make sure that you see that the chest is rising as you were breathing in. Okay? And then you take another deep breath and repeat the inflation. You inflate the chest 6 times as quickly as possible. Another thing that you can do is you check for a pulse using the carotid pulse. The carotid pulse is the pulse that you can take on the neck region. If there is a pulse, continue chest inflation. So a chest inflation, what you are doing is you are breathing in and then you push your air through the mouth of the person. Approximately you are doing it you are doing it every 6 seconds. You are doing 10 inflations every 6 seconds until the victim can start to breathe. If there's no pulse that is seen, you can start cardiac compression. This is where now you start pushing on the chest like that. If you do a cardiac compression and then you do a chest inflation, cardiac compression, chest inflation. In other words, you do mouth to mouth, you press the chest, mouth to mouth, until the person can start to breathe. There are some guidelines that you use when you are performing mouth to mouth. Speed is essential in order for resuscitation to be effective and brain damage to be prevented. If the lungs fail to inflate, this means that the airway is obstructed at some point. Imagine you are doing a mouth to mouth, you breathe in and then you push your air through the chest of that person, but then you can't see the chest rising. That means that there should be some obstruction somewhere. So you want to make sure that no air is escaping from the sides of your mouth and the head are not slipped forward. Okay, so these are the reasons that will be able to cause the chest to fail to inflate. If there's some air which is flowing on the sides, or there's something that has closed up the air passage of that person. So something that you want to check in case the chest is not inflating as you perform a mouth to mouth. The head must be extended to allow the tongue to fall forward. And you want the tongue to fall forward so that when you breathe in, the air will go through. You are going to look for vomit or other obvious obstructions in the mouth. When you see them, you're going to remove them by swiping your fingers through the mouth. If no obstruction is seen, attempt to remove the unseen. And how you are going to attempt to remove the unseen is you can use any one of the methods that we talked about. Okay, you can, where you perform a maneuver like that. Also, obstruction by rolling the patient onto his side and slapping his back smartly between the shoulder blades. A child can be held upside down and the back. So this is what we are saying. You are trying to remove the unseen. Okay, this is how you do it. Well, we already described how to do that and we showed the pictures earlier on. If on initial assessment the patient has a pulse, continue to check the pulse at regular intervals during the mouth to mouth to ensure that the heart is still beating. A person has a pulse, okay, make sure that the pulse is always there. You are performing your mouth to mouth so that a person can be breathing, but don't make sure that the pulse is also there. Okay. So that is how where we're going to end for the asphyxia. In the next class, we'll talk about how do you handle drowning? Someone who was drowned.